It is the most amazing, most hugest honor ever to have the biggest rock star in dentistry, Dr. Delia Tuttle, to be on my podcast interview at the Townie Meeting 2016. This is our 14th annual Townie Meeting. I got to tell you something, Delia. Is it Delia?
Delia.
Delia?
Yes.
Okay, the only D I ever got in my life was in Spanish. And after 1 year of piano lessons, my piano teacher actually fired me. She told my mother that I couldn't carry a tune in a lunch pail. So when when you get fired from your piano teacher, who's probably in it to make money and get a D in Spanish, I don't have a good ear for sound. But seriously, when I was in school, it was a male profession. When I got out in '87, predominantly male. Now when you go to dental schools, it's half females. I don't know of a bigger... Now when you go to dental schools, 45% of the class is women. It's almost
females,
half women.
That's right.
And I can't think of a bigger, better, bolder woman role model than you. I'm dead serious.
Thank you. Thank you so much. Thank you for inviting me.
Oh, my God.
It's a pleasure to be here in Vegas.
So you were born and raised in Romania.
Yes,
you graduated
Transylvania.
dental school.
Yes.
Transylvania?
Transylvania. That's right.
So did you ever see the Rocky Horror Picture Show?
There
was a song there, born in Transylvania, one of my favorite movies. But then you came to the United States.
Yes,
and then,
about
of course,
10 years ago.
And of course, they wouldn't accept a license from another country without going through the foreign deal. So you go to UCLA.
I went to UCLA, graduating in 2009.
2009. This is only 2016. So that was only in 7. I mean, you come out of school.
Yes.
And in 7 years, you're like one of the biggest names in dentistry. I mean, you got 15,000 people following on Facebook. Your work, some of the greatest surgeons I know, like Ziv.
Oh, yes. Ziv Simon from Beverly Hills.
I mean, so many of the greatest surgeons I know just say that you're different because you just have gifted hands. I mean,
I'm just fearless.
I see it like this. You could have two people go to singing school for 8 years. They both become a doctor in singing, but one person can sing and the other person can't sing. Imagine two people go to painting school.
All right.
And one gets a doctorate in painting. The other one never went to school, but the one didn't go to school. Your hands, you do stuff that no one else could do.
Thank you. I'm trying.
No.
It's a lot of work and dedication. It's constantly learning, constantly, being, hunger for education. I just wanted to succeed. I'm actually living the American dream. I do know lots of international dentists, and it's quite a transition when you move from another country to be successful in the States. And I did everything in my power to succeed. It was a long journey, beautiful journey, and I'm so happy, to be here today and have this opportunity in front of the camera, for sure.
Did you come with your husband, or did you meet him here?
No, actually, I met him here. All my life.
You came alone?
Yes,
Just by yourself?
All my life, I was trying to fight mediocrity. That was my goal. So I came many times to the States, to many dental conventions, and I met my husband here in the States through one of my friends. Her name is Tanya. And then I went back to Romania, and I came back again after 3 years, and we decided that we are soulmates, and he proposed after 6 months. And I said yes. I left everything behind. My parents went very mad. They were very mad because I left after so many years of education in my country. And I came to the States. I studied really, really hard. I was accepted at UCLA. I applied actually only for 2 schools because my husband had his job in the States and he didn't want to move. So the chances were very, very limited to go. And there were only 12 seats available per school here in South California. And I was very honored to go to school. It was a great experience. It was worth it, every penny I spent for my education. So it's been good.
So you said something right out of the gate that I want you to dwell on, and that is the fact that the bottom line is you're fearless.
Yes.
Every dentist has a million reasons of why. Well, I look at this because the specialists, that they want the case. They want to make the money.
Sure.
So they're saying, well, you should have referred that root canal to me because we've done so many more and you haven't done any. And I always say, well, didn't you ever have to do your first root canal? I mean, how many root canals did you do on your first day of endo school? I've done more root canals as of to date at age 53 than any endodontist who ever got out of endo school.
I'm sure, yes.
I mean, I've done a gazillion of them. And so, so how do you how do people get good at endo when they say, that root's really curved, I'm going to send that to an endodontist? Well, they always have 400 reasons why they need to not do it, and you just always seem to just do it. Is that something you're born with, or are you fearless, or?
Not really. I after graduating, dental school, I had a lot of loans, and I wish to go for further education since I do have a medical background from my country. So I graduated as a medical school in 2000. I graduated dental school in 2005, and then I moved to the States. And unfortunately, I couldn't go for further, education. I had in mind a career for oral surgery. And then right after school, my son was 2 years old. It was a very tough time. My husband really worked really, really hard for us to go through school and everything. Very supportive family. I'm very, very blessed. And I decided just to go for it. So I had a couple of choices. I went for a couple of interviews, and I decided to take the hard road. So I worked for a corporate for 3 years.
Which one?
Pacific Dental Services.
Steve Thorne.
Yes, absolutely. I was driving probably 2 hours and a half a day. To go to this beautiful location. I work towards the Palm Springs area, and I developed great leadership skills there. Being a general dentist, I had to support, the schedule for all the specialists. It was very, very hard because it was allowed for us just to do restorative procedures, no perio, no oral surgery. So I had no choice that make it work. So you had to survive. It's one of those things. I had a great relationship with the specialist, and I wanted to make sure they have great schedule. But in return, they taught me some things. So when I was ready, I left, the group, and I jumped fully into a private practice. So
did you start from scratch, or did you buy one?
So this is what happened. I bought a practice from 2 dentists with only 2 days of patients. And it was a mixed practice, HMO and PPO. And in 3 weeks, I was fully booked 6 days a week. And then from there, everything, opened the door for everything. So when I bought the practice...
So why do you think those 2 guys only had 2 days of patients and you bought it and you're booked out 6 weeks in advance?
They had different practices, so they were not able to actually concentrate and put the time in the practice. Where I am, it's in Lake Elsinore, a very pretty area, Canyon Lake. It's next door.
Outside of San Diego.
It's actually 1 hour and maybe 20 minutes from San Diego towards the winery where Temecula is. And they didn't have the time to put into the practice. It's in a shopping center. Both of them had different practices. The area is very new area. Lots of people are moving into the area from Orange County or maybe LA area. And before I jumped in, I looked at so many things before I bought the practice. I looked at the locations, I looked at the possibility of expanding if I will grow in a couple of years. I was very, very blessed to be there, put all my time for my patients, and in 3 years I was able to double the space. So I doubled my practice in 3 years basically after I was done, after I bought it. So this is.
And what's amazing is it seems like when I go, it's like 80. I read like 89% of every student in America studying to get a PhD was not born in America. And whenever I go around and see the most amazing dentists in the world, it's the hungriest dentists from 220 other countries that come all the way here. And then when they get here, it seems like the American people have some anti-immigration thing. When I can, and then you look at the IPOs. I mean, it's like 4 out of 5 IPOs in the United States. They're always by some Delia who came from Romania. I mean, Google. Sergey Brin is from Russia. I mean, Intel. Andy Grove was from Hungary or whatever. I mean, it's like this country was built on immigrants. And whenever I meet just a world-class dentist that just blows my mind, they were never born in the United States. Have you noticed that?
Yeah.
Because it takes a special breed of cat to sit there and say, I'm gonna leave my country with the shirt off my back and come all the way to I think is the greatest country ever,
It
and it's just I mean, good Lord, they should, every time an immigrant comes to this country, our government should be giving them $10,000 cash at the border and trying to find them a place or help them, because I mean, it's just amazing what these immigrants do. I mean, we truly brain drain the rest of the planet.
It was not easy for sure to leave everything behind. Studying a different language, trying to break that barrier, language barrier. Going to UCLA, and it was very intense. I was very, very blessed, with everything what I accomplished during UCLA. I knew that when I'm done with the training there, I have to pay for all the continuing education courses and everything. So basically, I lived inside the UCLA. I went for every single course you can imagine. I assist every resident I could. I took advantage. I was like a little sponge, ready to jump. So if you are working really hard, if you care what you do and you do have a passion, it's impossible not to succeed. So that's my vision. So everyone can do it.
And what kind of practice do you have? How would you describe your practice? I mean, is it a family practice? Is
Yes,
it a reconstruction practice?
I'm a general dentist. I do a lot of specialty procedures. I rarely refer out. Mainly, I refer out complicated root canals or maybe some TNJ, cases. But basically, I can treat anything comes through the door, from periodontal surgery to implants, dental side arches, hybrid, single implant cases, to any procedure you can imagine. So it's all about building to the pyramid. I mean, if you are really good, when you're done with the school and you go to certain classes, you have a passion. I'm watching webinars, 3 webinars a week. I'm interested in some procedures.
Where are you watching these webinars?
Because my email is everywhere. It's kind of, on social media. I'm getting those emails all the time from different companies like Academy of Fossa Integration, Dr. Ziv Simon. I went on Dental Town. I recently took a class actually on Dental Town on a removable bridge, the Aryan Deutsch. Did that German.
Yeah.
So I'm interested about doing those for periodontal compromised patients everywhere at Dental XP, YouTube, everything I can get my hands or my eyes on. Sometimes I do in between patients. I'm very active on social media, and that opens the door tremendously for me. Seeing cases every day, then go ahead and practice and seeing like a similarity with the cases you saw. You are going to conventions, you buy certain instruments. I don't have too much technology in my office at this time, but I can do miracles just with a bird and a scalpel. So I am excited to share it.
Do you have a CAD cam?
No, I don't.
You don't have a CEREC machine?
No, I don't.
Do you have a $75,000 laser?
No, I don't.
Do you have a CBCT?
No, I don't.
And you have the biggest practice known to man, and you're the greatest surgeon, and you're the greatest everything, and you don't have any of those toys. And these people think they have to buy all these fancy toys to be successful, and I can't. If I had to pick one person to work on me, it'd absolutely be you.
Oh, how sweet.
No, I mean,
you're welcome anytime.
And I'm dead serious. And you don't have any of that stuff. And when dentists are making money, is they're standing on a rheostat with a drill in their hand or a scalpel or a suture, and it's not technology dependent.
Yes, exactly.
So then, are you doing, when you place implants?
I do place implants.
So do you use surgical guides or non-surgical guides?
I used to place free-handed implants for about a year. After I bought my practice, I had the freedom to go ahead and start doing implants. And then after a year, I saw lots of cases coming in from the previous doctors, or maybe outside of the area, and they were like not really ideal placement, and I decided to take it to a different level. As a general dentist, you wanted to make sure you do specialty work, but you do it at the highest standard. So if you ever go to court, you are going to be judged the same like a specialist work. So I decided to go and I took a class on guided surgery, and it was amazing. I took it with the Implant Direct, and I was very, very excited because
who's the founder of Implant Direct? Jerry.
It was Nisnik, but he left.
Nisnik,
he left.
yeah.
Yes, he left right now. The company. It's a small company. I'm very happy with it.
Implant Direct.
Implant Direct.
It's
yes.
a huge company.
Yes. It's not from the first, companies out there, but I'm very happy with the product. It's made in USA, in California. I took the surgical guide. I took the surgical implant placement guided surgeries, and I came back from the course. And in a couple of weeks, actually, I went and I did a hybrid, the dentulous case, 7 implants. That was my first dentulous case, which I'm going to present actually tomorrow for my lecture here at Dental Town. And then after that, everything kind of fell in place. I wanted to be at the standard, the highest standard. Everything what I do, I took for every single implant case, I do a CBCT. I'm referring my patients out to a center. They have a very good ICAT machine. I did everything in my power to convince my patient to go to get the CT scan because I wanted to make sure I place it right. I bought the software for anatomage. So I'm overlapping all this information and my implants are turning just fabulous. And if you know about soft tissue management, and that's why I opened the Facebook page, which is International Follow the Pink, you're going to be so successful as a long term. So that's pretty much, the story, with the implants.
Well, another thing about you is not only, did you come here from Romania? I'm sure they're crying every day that they lost you to America. But not only are your implant and surgical skills top 1/10 of 1%, your marketing was genius. You had this whole campaign of Follow the Pink, which everybody knows about. There's no dentist on Facebook that doesn't understand Follow the Pink. Where did that come about? Did you just think of that? Or that just?
I was just fascinated by the soft tissue. In the mouth, everything heals in 2 weeks. It's about 2 weeks of healing. But what's under is important. What we do with the bone, how we place the suture, everything is like that. I was just fascinated. To be able to graduate from UCLA, we had to do periodontal surgery. So I was blessed to learn that. We learned how to do frenectomies, pocket reduction surgery, crown lengthenings. And that was, the start point for me. If I just, feel that crown lengthening procedure can open the doors for so many areas. If you know how to lay a flap, you are going to be able to lay a flap if you have to for an implant. If you know crown lengthening, you know how to save teeth. If you save teeth, you are a dentist. That's what we went to school for. And if you know crown lengthening, you know how to do periodontal plastic surgery. You can work on those beautiful gummy smile cases, which I'm passionate for. And it's just opening the doors for so many areas. So I really, really highly recommend if you have a fear for surgeries and take a really good course on crown lengthening, and it's going to be amazing for your surgical skills. So that's my advice for the people out there, especially for women, which are a little bit, have a little fear for the surgical aspect.
If I go ask a bunch of male dentists, like, who's your role model? Who's your idol? They're going to say Dawson or Coyce or Spear, all these guys. But so many of those women, I say, who's your idol? They say you. And they say Follow the Pink. And then I ask them, I want to ask you this. So, some of these women think that they graduated in an all-male profession. And they go to the study club and they're like the only girl. And it's kind of they feel I don't know, they feel like they don't fit in. I feel like you just moved in and it's like
I'm just fearless.
Yeah, so what, do you feel like you're a woman in an all male profession, or do you not even see that?
No, I do feel like it's this way.
You do feel like you're a woman in a male profession?
I do feel like, for example, I had to go to have a lecture for the Implant Direct for my company, and it was probably one woman in the room, and the rest of the audience was just male, and they were looking at me, and everywhere I go, majority of the audience, I looked and they're all male. And then I'm so happy to see a woman there. I'm going and I'm chatting with her, encourage. I like to inspire people, not only women, in general, everyone.
Was it really a woman? You're in California. It's probably transgender. was it really a woman?
It was a real woman, yeah. I was in Vegas, actually. What
would you say to a young girl that intimidates her? Did that intimidate you, or did that?
Yeah, in the beginning, a little bit, but you learn how to overcome your fear. You learn to be confident. Every day you get better and better. Of course, it's not easy, to come out there, post something on social media. Like I started maybe 2 or 3 years ago when I was very shy to post anything just because of the negative criticism. Salvador Dali said, you have no fear, for perfection, you'll never reach it. So if you're out there and you're trying, to come out and, try more things, just try to be fearless. Every day think positive, be confident. If you need help, ask for help. That's what I did. I was transparent. I put my cases out there. I got criticism. I took it to my heart. Next day, I was trying to, to go back. But in the same time, I got connected with this amazing international, dentists all over the world. And overnight, I was so overwhelmed with so many positive feedback. Now we do have a group called Divas in Dentistry, which is international as well. And a lot of women from Russia, Portugal, Argentina, Mexico, we are all sharing cases and helping each other to succeed. So it's pretty phenomenal.
Have we been talking to you about doing a Divas in Dentistry convention?
Not yet.
Well, really, can you go find Lori? Because I told her what I want to do is I want to put together a townie meeting with just the theme is Divas in Dentistry. And just have a complete, because you are the leader of the Divas in Dentistry, and
Correct.
Every woman rock star dentist from here to Romania that I've ever heard of in my life is following you.
Well, not all of them, but
All of them. And
I'm here to help. That's for sure.
So follow the pink comes from Pink Gums.
Yes, from soft tissue management, and is addressed to dentists, can be hygienists. They're a little shy to post though, and also lab technicians, because sometimes in aesthetics we are talking about pink aesthetics, and if you have no choice and you have to do a restoration, do like a severe ridge, resorption, then you have no choice, and you wanted the lab technician to be in the group, so they will guide you what will be the best how to do this. And other lab technicians started to post as well in the group, and I'm very happy with that. And actually I went for a DTG symposium last weekend, and I mingled with a lot of lab technicians, so I'm trying to learn more about the lab
DTG?
part. DTG.
Was that in Utah?
Yes, that's the one. Absolutely,
I was
Grow.
out of the country. I wanted to go to that so bad, and I was out of the country.
Yes, you learn so much. They talk about their part. You know your part. They have all kind of demonstrations on the floor. You can mingle with them. If you have any questions, you can ask. And I got to meet a lot of important people. If I do have questions, they always can answer. And I got very blessed to work with one of the best lab technicians, which is Bill Mare. He's originally from Africa, and I'm doing an amazing cases with him, which you see on social media.
Where is he from? Where in Africa? South Africa, Johannesburg, or Cape Town?
I'm not sure exactly. I think it's South Africa, but he's in Oregon right now, and he's just a one-man show. He does everything by himself. He's putting that fingerprint on his restorations, and it's absolutely amazing work he does.
So what would you say? Being the role model they are, what would you say to a young woman who just came out of school? She's $350,000 in debt, and she doesn't know if she should just go get a safe job at corporate, or if she should bite the bullet and buy a practice. What would you say to her?
Yes, I will say, do not buy the practice. We are not fully trained after graduation to be able to manage a dental practice. There are so many things besides teeth. It's just overwhelming. So you have to, develop your leadership skills. You have to know how to manage staff, how to manage financials. So one day you are going to be able, to, hello.
This is my president, another diva in dentistry, Lori. And I think the biggest meeting.
Nice
have you ever
meet
met
you.
Delia?
No, we haven't met
She
yet.
is this is my president, Lori Zalowski. But
yes,
she's
we've been collaborating
she's
on the
the
emails, that's
brains
right.
behind Dental Town, and I'm just the front man. And but she leads the divas in dentistry. Every woman rock star from here to Romania to Europe to anywhere. She's got 15,000 followers. We need to do a Dental Town event. We need to do the divas in dentistry. It would be.
Okay.
It would
we have
be.
the Dental Town Learning Live.
Yeah.
Events
I think we
we're
should come.
doing now.
What city do you think it'd be best in?
Las Vegas is pretty good.
But I'm telling you, she's got 15,000 followers in Rockstar. When I go around and I talk to guys, well, who's your idol? You know, it's the same old men. It's Peter Dawson. It's Coyce. It's Spear. It's this or that. When I go to the women, it's always Delia Tuttle. I mean, she's just, I don't know. And I asked her, I said, well, if you weren't the number one diva dentist, female dentistry, rock star in dentistry, who would it be? And neither of us could even think of who number two would be.
Well,
she's that far ahead.
You're too sweet.
No, she's that far ahead of the pack.
Awesome.
And we need to do it. And you should submit us the list
Yes,
of who should
absolutely.
lecture there, and we'll do
yes,
it.
I was just blown away by the divas in dentistry cases. Actually, I met with some of them. I had one of the divas, Ana Luis Bernotti, traveling from Venezuela a couple of weeks back, and we were talking at the office. She showed me her presentations, and it's unbelievable cases. Then we have Raquel from Portugal. She is very, very good with the really heavy surgeries. I mean, moving the IA nerve to place an implant, that's her favorite thing to do. Sinus, it's just fearless. Those girls are fearless. Anastasia Smolyakova from Russia. We have even younger ones coming to the play from Mexico. Right now she's having a baby. Her name is Mirna. And then also I'm trying to engage also the hygienist, in Divas in Dentistry, through my friend and my hygienist, Amy and Doria, trying to encourage them to come up to the plate. There are so many things to talk about in hygiene department as well. And Argentina, I have my very, very good friend Morvarid. She's a lab technician and a dentist as well, and she has followed the white. She does everything. Her husband is orthodontic surgeon and facial plastic, and they transform lives, of the patients. The cases are just amazing. Cleopatra is working with biological factors in Greece, and she's the one that does the facial aesthetics with the IPRF. And then it's just amazing. They will be here in this summer in August for the ICOI meeting.
All of those people will be.
I'm trying to get most of them. We're trying to get some pictures from marketing.
What month is the ICO meeting?
Is in August.
We should do it in August, and while
we
they're
should do it
all
in
here
August.
in the United
We're all
States.
here.
I mean, this is all women, all elite. Every one of them women, almost every male dentist that you've met in your life, they couldn't even do their scraps.
Yes.
I mean,
sometimes you get a lot of private messages, about cases, even on Dental Town, and, a little shy to post out there, and just most of them, watching the cases. And then they have the private groups as well. I noticed there. And then just the other day, I post like a video. Someone asked me about some suture
Well, you know why?
Yes.
Only 1% of the dentists post cases. 99% won't, because of fear.
The fear, yeah.
Of criticism.
And the fear, in a way, it's good in the beginning. It's like a positive thing. I mean, you get back, the positive criticism, the negative criticism, but you have that ability to stand back and get the good and the bad, put it together, and this is how I progressed. You take beautiful pictures. At the end of the day, you look at the case, how we do differently, this procedure, and then you get there. But you have to kind of break the barrier, So you just don't be shy anymore. Don't care what other people are saying. Just be fearless and be out there.
Well, and that's true. But
Yes.
this will be the biggest thing. I mean, these are the most amazing women in the world, and every one of them is eating out of her hand, and she's the leader of the pack. And this will just be so damn fun. And like I say,
We'll have to email and get together.
Yes, absolutely.
do you have her email?
Yes.
Do you have her email?
Oh
Okay.
yes, and you are so good at responding all the time. Thank you.
Welcome.
Yes,
Of course.
absolutely.
All right.
Yes.
Yeah.
But okay. I think one of the reasons
Thank you. Thank you. Nice to meet you.
99% of the people won't post because they're afraid of criticism.
Afraid,
and,
yes,
and a
absolutely.
social animal, they just
but
can't
it's a good
overcome
thing. It's a good thing. It's a good thing, breaking that fear. And I'm really sure and positive that more women will post if they have encouragement and support. I got very good feedback from the men as well, saying, good job out there. I'm so impressed. Even here at the convention, they came to me and said, I love your cases.
I just always loved the criticism the most, because I always thought to myself, so many of the 7 billion earthlings, they have beliefs in their mind that just aren't right. And I always thought, I started writing a monthly column in 94, and I used to love it because when you write something that was wrong, immediately you get 100 letters and emails and all that is wrong. And I just think, God, I'm so lucky, because I have all these friends and homies pointing out. I mean, even on arcane life stuff. I remember one time I made a comment that 5-star patent, general patent said this: as long as you keep moving and keep taking risk. I got 100 emails said patent was only a 4-star general. You know, the point was that, you know, his military success plan was just if we don't dig in, we just keep advancing, we don't dig in, and we keep taking risks, you're going to win the war. But I had 100 people point out that he wasn't a 5-star general, he was a 4-star general. I mean, just I'll say stuff in orthodontics, and Anne-Marie Gorsuchek will immediately say, and on any of these podcasts, if I say anything that's not orthodontically correct, I got an orthodontist, Anne-Marie, that's been, oh, you said this, and that's absolutely wrong. And I'm just thinking to myself, how lucky am I that I got friends correcting me
yes,
and taking wrong
absolutely.
information out and putting in information. But you got to have thick. I don't think it's thick skin. I just think it's the fact that I don't know. It's just never bothered me.
Yes.
I don't know if I'm socially
I know,
retarded
but you are
or
different, though.
yeah, maybe I am different.
You are way different.
I think also part of it might be is I look at humans as just a little bit different than a cat and a dog. So when you come home from work, you don't look at your
Yes.
cat and say, "Well, you lazy cat, you've been laying here all day. You're a bum," and kick it. You just think, "Well, it's a cat."
It's a cat.
When you come home and your dog, you know, craps on the floor and eats your shoe, you don't shoot him because you had no expectations for him. And I think people hurt themselves the most because they have such irrational high expectations of other humans' behaviors.
Correct.
And when you lower your expectations for all 7 billion people to that of a cat or a dog or a monkey and realize they're just talking monkeys.
That's right.
How do you get mad at a talking monkey?
Instead of helping, you know, if I can give you one single, you know, tip or maybe something that to help everyone out there will be to invest in photography. Photography really changed my attitude in dentistry, changed diagnosing, treatment planning, case acceptance, marketing. So if you want to progress, buy a good camera, go to a good course.
What kind of camera? What kind of course?
You just had a course here at the Dental Town with one of the biggest, you know, doctors here recently. You can take a course. I took a course with Milos Miladovic. You interviewed him before. He's from Romania. I went all the way to New York because it was not available in here in California. And I have 2 cameras when I'm working with. One, I have a flash Nikon, you know, flash camera with Nikon, and I'm using basically just for my surgeries. And I have a different one with the R1 C1 brackets, which I'm using for cosmetics. And I bought also a Elichrome system with the lights, so I can really see the shade. I can really see the texture of the gum. I can take beautiful pictures, you know, for my patients. At the end of the day, you go ahead, I have a server, I align all of them in my computer, case by case, and I go over the pictures and I can see what I can do better. I do have, from those pictures, I have tremendous information. I can do, you know, a keynote presentation anytime on any topic. I can create something for the patient, like a brochure. What's the difference between an onlay or a crown or a filling? I can show my surgery cases. I can show what's the implant, how is everything what you can imagine. You can play it in the lobby, so that will make you a better dentist, better case acceptance, and you are going to progress a lot in your career. So, and I have Nikon. Canon is good as well. Just find a very good course, and that's my biggest tip I give to the, you know, anyone which is watching right now, you know, the podcast. So that helped me tremendously. And Dr. Roberto Rossi actually gave me this tip. You interview him as well. I'm having a great collaboration with him from Italy. As a matter of fact, we work, you know, together for some projects. And back then, I was just taking pictures with my iPhone, which is better than nothing. I didn't have time working in a corporate to really, you know, put that time, you know, into it. And one day he inboxed me and says, "Delia, you have great cases, but your photography is really, really bad. So please do buy a good camera." Next convention, I went out there, I bought a camera, and then since then, you know, the social media just gave me so many opportunities. I mean, I'm invited to all kind of events. I met interesting people. My career took a different approach. My practice grew. Case acceptance is high. So everything started from photography as well.
So another thing I want to talk about, a lot of people, I believe, will never do the cases you do, not only because they probably don't know how or can't do them, but they could never even sell them. It seems like you'll see a person come in with 20 things going wrong.
Yes.
And these little shy, timid say, well, let's do the filling here, or we'll just extract the one that's had it. How do you have the mojo, the karma, the energy? I look at some of your cases.
Yes.
I mean, you're just presenting game-changing treatment plans. And they're saying yes because I see the photos of your work. Why do you think? Why do you think you're just saying let's go for it and let's do this big case? Whereas most dentists say, well, let's just fix the one that's bothering you the most.
I see.
I mean, it's not just a question they couldn't do the work you're doing. They wouldn't even have the balls to present.
Yes.
Yeah.
Well, success is about passion. And I do have a lot of passion for dentistry. And also success is based on personality and the sense of humanity. So if you blend in all these three, you're going to be successful. Now, when a patient comes in, I'm not going to jump and say, oh my goodness, your veneers are looking like really tiles and your teeth are very square. And I'm going to jump into negative, criticism as long as they step into my practice. I'm trying to get to know them. I'm asking them about their chief complaint. I always address the chief complaint first. Of course, I'm addressing the periodontal status as well. And then slowly, as the conversation goes, we take photos. I put them on the screen, and then we talk about the smile. And if they are going to say, oh, wow, it bothered me for so long, this gummy smile, or maybe the implant is placed in the wrong position right here in the front. So what do you think about that? Then I kind of create like a little window to get into their world based on the photography, what I'm telling you. And then from there, the discussion can be open. But I'm not going to be negative. Well, I am practicing as a general dentist in California, where people are more interested in cosmetic work as well. They had cosmetic work in the past, maybe 20 years ago. Now is failing, so they know it needs to be replaced. Like any other plastic surgery, it doesn't last forever. Only diamonds are forever. That's what I'm telling them. Only diamonds are forever. And then I'm trying to approach, them differently in a very sweet, nicest way. And then I said, hey, I do have a similar case. Would you like to, me to share it with you? And then I'm having my keynote presentation right there. I have iPads in my office. I open and I'm going to show them step by step how it's done. They go home. I'm not pressuring them in any way. They go home. They think about it. And I have patients, they return after 2 years thinking about, what we talked 2 years ago, and then they go ahead and proceed with the treatment plan. So it's all about if you are confident about your work and you're confident, patient can sense it. Patients now, they're very educated. They're not, coming from an area they don't understand about veneers or about the gummy smile or lifting the gums, receding gums. They understand so much more. They have Google. They go Google. They Google you. They see what you do. They come to me and say, I want that kind of restoration for you to do it. I heard about this technique. They're very educated. So they have high expectations. So in the same time, you have to balance, everything together. Can be a blessing in the sky or can be, a curse because they have high expectations and the case is very hard to do it. You have to talk to them from the beginning. So it's like a completely, round approach, taking in consideration all the aspects plus the legal aspects as well. Taking those photographies, before the x-rays, having a very correct treatment planning from the beginning, informed consent, everything signed. That makes you like to have a better way, to approach those patients.
Delia, you talked about when I said, okay, this you're coming out of dental school, should you buy a practice, go work over? And you said, you're not trained to take a practice. You need some more experience.
Correct.
I hear a lot of younger women dentists that believe that it's harder for a woman to lead 5 women in a dental office than a man. Is that true or false?
From my experience, it's false because I'm working with 7 beautiful women and they all have one name and it's a diva. So if I need anything, I'll just call, hey, I need a diva here, It doesn't matter. You can't go wrong with that. So they're amazing. You'll believe that there will be so much drama in the office and so much negativity and everything. I feel, for my husband because he's the manager of the office and he has to deal with all of us. But for some reason,
I somehow feel like he loves the job. But anyway.
yes. He's just going to, twink an eye, and then we know we are in trouble. But I'm getting along, with everyone. It's very important to have leadership skills. When they see your passion about your dentistry, you involve them in the cases. Recently, I just sent one of my assistants to a photography class because it took me a long time to get, all, the photos, and, in that time I can do another procedure. So now she's in charge with that. She's so excited about the pictures. If they want to grow, there is room to grow. One of my assistant went actually for hygienic school. She's actually going to graduate this summer because she wants to progress. I'm not holding them back. I'm pushing them forward, and I know all of them wanted to return. If they wanted to go for extension functions, I'm going to make that dream, that dream coming true for them as well. So seeing me excited about dentistry, seeing the patient environment, it's like patient as soon as, they step in the office, they sense the tension-free environment, and that's so important. If you step in an office and kind of, the receptionist is mad because she had a bad day or the child did anything, but when we are at the office, we are really having fun. We are talking about cosmetics. What did you shop last time? I'm taking them shopping. I do reports every 3 months. I give races. It's very important to make them happy as well. And I feel like I'm a good boss. I'm handling everything with diplomacy when it's like a tension situation. I am the one working with them, and it is just flowing. And my husband is having a hard time wearing pink at the office.
Yeah.
That was the hardest part for him, but we converted him. So today I bought a tie with the little pink he's wearing it. Tomorrow, a little light pink shirt. And by the time he's now realizing he's wearing a really straight pink. So we converted him as well. It's all about the pink. We have pink gloves, the pink mask. We are like having follow the pink, logo on our shirts. We have different rooms as well, like follow the pink room. We have Africa. I wanted to do one, as I told you. We have Paris room, we have New York room, and then how do you feel today? You feel a little bit, Marilyn Monroe room. So my patients are like really treated so well, and we are all happy working together, and the patient can sense that environment, which is so important.
I mean, your clinical skills are unmatched, but your marketing skills are genius.
I learned from social media, and I know someone who does it very well.
No, your marketing, your Follow the Pink campaign was. I can't think of any dental office who did a marketing campaign that was more bullseye marketing than that. I want to counter. There's these big billion-dollar companies control a lot of the message. Big, powerful social media people. By the way, how do they follow you on Facebook? Facebook.com.
It's Follow the Pink.
Follow
the Pink, and I'm public. I'm public as well on my Delia Tuttle as well.
What's
and then
your
we
Twitter?
have
At Delia Tuttle?
Yes.
And that's DELIA TUTTLE.
Yes.
So at Delia Tuttle. What is it on LinkedIn?
It's the same.
Delia
I think
Tuttle?
I have the same. Yes.
Okay.
It's either Delia Tuttle or
Facebook?
Tuttle Delia. It's
Okay.
either way.
So,
and I have Divas in Dentistry and
so a
Follow
lot
the
of these
Pink as well.
billion-dollar companies are telling everybody that you can just do the veneers chairside with a CAD cam.
I see.
Do you think you can take a monolithic block and mill out and do veneers to the level that you're doing, or anterior crowns and
yes.
not use a human making this on a lab?
Honestly, I don't think so, but I do respect everyone's work. And
Right.
as a matter of fact, being a corporate before, I got to try those veneers that you were talking about. It was a long day.
But don't those kind of look like
day.
fake fingernails compared to what Feltz? What are you doing?
True.
Feldspathic porcelain?
I do feldspathic as well, and
But-
I do Emacs cut back and layered. Yeah,
but
that's
can
right.
feldspathic? I mean, can a chair side
No.
monolithic CAD cam veneer or crown on a front teeth? I mean, I get it. If you're working on a guy like me, he's a 53-year-old fat bald guy. He doesn't show his teeth. On me, you could probably just pull the tooth and not even replace it. But if it's a good-looking girl
Yes.
and she's got a high lip line,
Absolutely.
you can't do CAD cam on a monolithic block and have
Yes.
a bullseye cosmetic work. Do you think so?
No, I don't. I don't believe in that.
But do you
I
hear
work,
anybody saying
I
that?
Do.
Do you
I do.
do you hear anybody with the
no,
balls
I do
to
not
say
want
that?
to make anyone mad. Hello.
Because everybody's afraid to make
yes,
anyone mad.
exactly.
And
But
I
you know,
just think,
you know me. I'm straightforward.
This
I'm
is
really
Dentistry
bald. I'm
Uncensored.
raw. I'm raw. I used to be even raw more, and I became a diplomatic over time. And I did have a chance to work with CAD/CAM for 3 years for Pacific Dental Services, and I got to experience from fractures to wrong shade to anything you can imagine. Taking, after another dentist or being in a practice, being a huge practice, you can see those people coming back. The biggest problem I faced there was not having the right blocks for the right shade. So even if you try to, to go ahead and do like to try to glaze it and do different staining at the chair side, it never looked the same. I did one case veneers, and I had to use actually my bird, to make it looking more natural. And we glaze it and we stain it, chromite the gum line, but never look as good, as they're coming from a human touch. I do not say that CAD/CAM it's not a good tool, because it's a fantastic tool. I really believe
But you
that
don't own
CAD. I do not own it, and I'm telling you why. I'm telling you why, and I'm straightforward, and I'm telling you why, because I am so anal about my work that I will never let my assistant to create the cusps or that occlusion that the machine gives, or I'll modify it. And then takes time for me to take it from the chair side, go do the design the way I want it, glaze it the way I want it, and stain it the way I want it, and in a short time. Because I do have a periodontal program very strong in my practice, my patients' gums are great, and it will be a great fit. It's just I do not trust, my assistant needs to be at least a lab tech to understand, the occlusion and everything. Even the CAD/CAM is very performant as well. So I'm very anal about my work, and I care. And then when they come back from the lab, they fit so well. They're so shiny and glazed, and they're perfect contacts the way I want it, the way I want it to be stained. So it's just easy for me to deliver as well. So that's the only reason I do not own a CAD/CAM, because it's a lot of work, and then maintenance, and then involving the staff. Then I have to be worried tomorrow, or like I have to deliver the same day. The pressure is on. Not it's always going by the book that I have to deliver the restoration in the same day. Other things can change on your schedule. I do have a big practice with I'm working right now on 8 chairs. So many things can do it, and I do not want to have my patients being mad waiting for me, like it happened for the other company. Sometimes they're there for 5 hours.
I know.
And sometimes you have to do it with the temporary cement and have them get back to do the right way. So I experienced all these pitfalls before, and then I decided not to have a CAD/CAM at this point. So that was the story about the CAD/CAM.
Well, it's like they went to school 8 years to be a doctor, and then they go pay $150,000 to be demoted to a lab tech. And it used to be they schedule an hour, and they would numb, prep, pack cord and press, temporize, hour. They're gone. 2 weeks later, come back for 30 minutes of cement, and now they're in there for 3 hours
Or 5.
3 hours, 4 hours, 5 hours, making a crown that they're not as good as their own lab tech.
Yes.
And they're doing a crown, and they've done maybe 20, 50, 100, and their lab man's done that many a week for the last 10, 20 years. And I think
yes, and managing the soft tissue was another issue for the other office I was working for, because it's not easy to do your bonding when it's everything everything is bleeding. You have to put your rubber dam. That takes time. You have to make sure you bond it. The cements are sometimes hard to clean. I like to take x-rays before and after delivery, make sure I don't leave that cement there, make sure the margins are closed. So if you really wanted to be successful, you wanted your dentistry to last, you're going to check those things. If not, you just do in and out dentistry, and that's the way you create your name. It takes, a lot of work to create a good name, especially when I'm planning to retire from this place, and I'm not going to buy any other practices. This is it.
Oh my God!
Yes.
You will never retire. You heard of her. She will do it when she's 103.
No.
You have more energy.
I do.
You couldn't retire if you had to. I want to ask you, I only got you for 10 more minutes. I'm just going through questions that I know you're an expert in. A lot of people in diagnosing and treatment planning, it's a first molar. She has gum disease.
Okay.
And they're young. I mean, these podcast listeners, podcast is a young behavior. They're almost all under 30. It seems like about 20% of these people are probably junior, seniors in dental school, and probably another 6,000 are probably been out of school the last 5 years, and they don't know, should I pull this 3-rooted teeth that's got a 6-millimeter pocket, and is that even worth the time? Should I treat the periodontal disease, or should I just pull it and go to titanium? How does your brain analyze to save your, and I have a feeling that you might be emotional like me, where you kind of lean towards, well, if it was my tooth, I'd kind of want to save it. I don't know if it was my tooth, if I'd be jumping to go to titanium. How do you wrestle that in your mind? To save or to forceps?
Absolutely. So this is actually one of my topic that I'm going to talk about tomorrow, and it's exactly the same situation you are talking about. I'm having this very young woman. She's about 34 years old, and she had some problems in the past, psychological, emotional, medical compromised patient, and she has all these huge cavities on the front, actually present in all her mouth. And then the question is, what am I going to do? I'm going to go ahead and pull her teeth when she's 34, or I'm going to go ahead and fight for it with the gum surgery. I'm trying to counsel her and put her on a special perio program. So for me, it's all about, let's say, if I wanted to, I'm not sure exactly how that tooth is going to do. I'm trying to, to fix the periodontal problem first. If they need endo, I treat endo, and then I do perio and make sure the pocket is this. If it needs periodontal infrabony defect or periodontic surgical procedure, I will do that. But I always start, let's say it's a very huge cavity. I always start with the caries control, and I see how far it goes and where we are getting to that point. And I'm fighting for the teeth. Even if I place implants in my practice, I always save teeth. And my patients know, word of the mouth, and they come sometimes for a second opinion from another dentist. I heard she's saving the teeth. Go there. She will save it for you. I do crown lengthenings, whatever is necessary to be able to do it. Now, of course, if the tooth has huge mobility, and then I feel like I'm not successful, with this tooth for the future, if the patient is young, better to approach it that way. Sometimes you can go for extrusion. You gain more soft tissue, and hard tissue. So you do like a soft and hard tissue management, and then you go ahead and do your implant. But all these calculations, the treatment planning, it takes time. It's not like jumping into a situation. I go, I analyze, I try to treat, I make it, happen for the patient, and the last resort is extraction for me. So it's a long journey until I made a decision. Sometimes it's just straightforward, but sometimes I just go ahead and fight for that tooth for sure.
Okay, here's another question I want you to help my homies out. My motto was in 1998 is when I saw the internet came out, I said, no dentist should ever have to practice solo again. And I started Dental Town 98. Facebook wouldn't be till 2004. I beat Facebook by 6 years.
I see.
They're walking into these dental conventions, and there's 175 different implant companies.
Oh, I see.
How do you help her pick an implant company?
Well, that's a tough one. It's you go through those courses, and everybody says my implant is the best out there, and has this coating and has this architecture, and the neck is this way, and it's friendly for the gum and for the bone to grow. It's kind of, you have to do your homework, and then for me I wanted to make sure my implant is fabricated in the United States. It's very important for my patients as well. I'm supporting United States economy as well, and then
you do that for quality control, or what? Is that emotional, political, or dental science?
When the patient is asking me, hey, I hope you're not going to send the crown to China, it's the same philosophy with the implants. Where are you getting your implants? Are those fabricated in China? So for the patient mentality is the same way for the crowns. So I said, no, they're made in the United States. They're here in California. I have, one implant in my mouth. I'm related to them. Hey, I'm human. I'm the same like you. I have it's a hard decision to make. You go to those conventions and you don't know what to look at. You look at the data, you look at the cases, you talk to people, you talk to important people like the titans out there, and try to make your own decision. So based on all these factors that I told you about it. So whatever you feel like.
So which one did you end up going with? Implant
Implant direct, yeah.
See, if I tell my patients, I said, do you care if it's made in China? They go, China? Is that near Albuquerque? That's why I love Phoenix. I mean, they couldn't find China on a map.
They want to know exactly where the implants are fabricated, where is my lab, where is my lab, who is my lab technician. Actually, they go on Facebook and they follow my lab technician on his Facebook page.
Who is your lab technician?
Right now I'm working all the cosmetic cases with Bill Marais, the one from Africa. I told you about him.
Yeah, and
he has his own
Africa
lab.
Or he's in California?
He's in Oregon.
He's in Oregon. How do you spell?
Bill Marais. Yeah, he's on Facebook.
How do you spell his last name?
Bill Marais.
M-A-R-A-S?
Yes. A-I-S.
A-I-S.
Yes, you saw him so many times. Yeah, he's fantastic.
I've seen him so many times?
Probably you saw my name associated with his name, because usually
M-A-R-A-I-S.
Let me take a look.
I'm on LinkedIn. Maybe he's William.
No, don't go on go on Facebook better. It's easy to find on Facebook.
Bill, you see him on LinkedIn?
No, better
Okay.
to go on Facebook.
Well,
It's
can
easier.
you shoot me an email?
Yes, absolutely. He's speaking international and the United States as well. He's very well known, and I've been hunting him for about 4 years. I could not afford, sorry, Bill, I could not afford you 4 years ago, but I saw his cases. His lab is called Disa Dental. Disa with S. Disa Dental. And I've been
D-I-S-A?
Yes, dental.
Disa Dental.
Yes, Disa Dental. And I've been following him. We met each other on Facebook, and I've been following his posts, his cases, and I said, one day I'm going to be able to work with you. And next year I said, hey, how much do you charge for this? I'm not at that level yet. Okay, let's try next year. So I've been following him for a long time, and after 3 years I'm able to work with him. I made it work. He actually was at my office not a long time ago. We worked together on my hybrid case, and we just finalized it. The townies are going to see tomorrow. My hybrid is just absolutely beautiful. He does hand milling. He doesn't have, a machine. He does hand milling. The zirconium is just amazing what can come up from his hand, and it's a one-man show. So it's you have to schedule the cases with him, in advance. It's pretty quick. It's just fascinating because when they're coming back, they fit so well. I don't have to adjust one thing. It's completely 100% guaranteed it's working, and it's saving so much from my time. Occlusion good. Contacts, margins, everything goes so well that I cement it very, very fast, or I bond. So that saves a lot from my time.
Last question.
Yes, I'm ready.
This one's going to get you in trouble.
All right.
So if you math, 1 + 1 = 2. I mean, it always equals 2. It's never 3. It's never 1. If I had to look at all the areas of dentistry, the one that no one can really measure, agree on, is occlusion. It seems like on Dental Town, there's the neuromuscular guys, the CR guys, the Dawson guys. They're young, and this is the specific question they're asking me.
Yes.
Okay, I feel like I need to learn occlusion. And it seems like there's like two camps. There's like neuromuscular and Pinky Dawson CR. If I wanted to learn more of occlusion, and I go read all the threads on Dental Town, and you can't get two dentists to agree on occlusion. What are your thoughts on occlusion?
Yes.
Is it voodoo? Is it overrated?
It's fascinating. Actually, it's very controversial, right? You're taking this class versus that class.
You got to come in. That's what your photographer.
Exactly. He had the photography.
She was just telling me.
And he's wearing pink.
Her number one tip was to master photography.
Oh, that's good time.
She was saying you were
so
saying.
Nice to meet you.
Nice to meet you.
You were
Delia,
saying.
Tuttle.
You just said.
Nice to meet you.
Come over here. You're talking to 8,000
nice to meet
people.
you.
Okay, great.
Come over here, Colleen.
Hello,
you
8,000 people.
Hello.
She just said her
going
main tip advice, her game changer turn was when she started doing photography. And I look at the photography as you were saying it was feedback for your work. You were saying
Feedback
that you
from other peers, like I'm very on social media, I'm very frequent there, and plus, I can analyze myself as well. So that tremendously changed everything for me. It was the best thing I ever invested in. So I know you had the photography class. I saw you.
Yeah, that's right.
Yeah. Yes.
And
Absolutely.
this is the
That's
man
the
that
number
teaches
one
you
tip.
to take your photography and then Photoshop the hell out of it, so everyone thinks you're a good dentist. And then you put, and then the other thing that you said, which is a total game changer. It doesn't matter if I'm here or South Africa or whatever, but
Yes.
the dentists that are photo documenting their cases and putting them on their websites. I mean, these consumers are a lot more sophisticated than they were in the 70s.
Correct.
And they're going to these sites, and so many of the patients that come into my office, they said, well, this guy said he's going to do that, and I asked him for his picture. He didn't have any pictures of his own work.
Yes. I know.
And it's
One of the things that's most shocking to me is that when I find out how much money dentists are spending on marketing each month, and then when patients go to their offices, they have no product to show them. They have no before and after pictures, and it seems
Yes.
like, it's getting the cart in front of the horse, and really the first thing you need to do is document your cases and take it one step further. It's not just documentation, but it's also presentation. And so we're opening up the doors these days really to go from these medical grade ring flash images to more dynamic, more beautiful pictures that people are used to seeing when they're presenting products to them.
That's right. That's why I do, part of my records are actually photos, and second is the video, so you can see the motion of the patient. So when I'm doing those gummy smile cases, everything is motion. You can't just, it's not like a fake mannequin we had in dental school. You have to see the lip movement, with the face expressions, everything together. So I do record, in the beginning, the everything like the pictures and the videos. Then I do the mock-up, and I do another set of photos, and I do another, video with the mock-up in to see, what I have to correct. So it is a game changing in dentistry, and if who doesn't have a good camera, now is the time. And I'm so glad, you had the course. It was about time to, expand, Dental Town to the photography. I know you've been trying for a while to do that. So he knows how important it is from legal issues, ethical issues as well, not only from marketing and your case presentation, but that opened the door for me actually to be invited on so many conventions. And then I've been having so much fun just because of the photography.
But I sent Delia pictures of my teeth. Said, "What would you do cosmetically?" And she
We'll
said, "I
Photoshop
would
them,
send
and
you
they would
to a
look so
vet
awesome."
and put you down." I thought that was
Yeah.
How do you improve this?
Delia. Delia said,
and you just give me
she
2
told
minutes.
me, she goes, "If you want to improve your looks, just turn out the lights." That's the only thing. Colleen, you got to say something. You can't just stand there and not say anything.
Sure, I can say something. And I agree. I mean, go out, take a course, better yourself. I mean, you need to invest in yourself. And if you want to do more dentistry, whether it's cosmetics or even if it's just ortho or posterior teeth, if you're documenting it and you have something to show the patient and kind of get them emotionally connected to these things, I mean, you need to learn how to do it. So invest in yourself, take a course, and you won't regret it. It will pay you thousands and millions, over the course of your dental
Absolutely.
lifetime.
Yes,
And
completely agree.
I believe you have a book on Amazon.
I do have a book on Amazon.
Yay.
It's called The Naked Tooth, What Cosmetic Dentists Don't Want You to Know. And it was written for the consumer, actually. I just kind of got fed up with seeing a lot of revisions in our office. And it was just more or less telling the consumer, just do your research, bottom line. So if you have these credentials, get this book and hand it out to your patients. It's a great marketing piece.
Excellent.
So
Thank you, Howard.
Again, it's The Naked Tooth.
The Naked Tooth.
And
I
it's on
love
Amazon.
it.
It is on Amazon,
The
yes.
name is so
Is that
cute.
Okay, and how much is the book?
On Amazon, who knows? Gosh, $7-8, like nothing.
Yeah.
Or just contact me personally. I'll sign it, send it to you.
Any other
That's
parting
great.
words of
I
wisdom?
am excited to be here, man. This tiny meeting is super fun. I'm really excited for the costume party tonight.
Oh, yes, me too.
Yeah. So I'll be heading over to that, and I'm just excited to be here, man. It's a great meeting.
Are you wearing pink?
It's a
Or
great
are you
meeting.
sucking up to
We're
Delia
just,
by
you know,
following?
I am. I heard it was Pink Day.
Follow the pink and
I
follow
heard
the
it was
photography.
coming, so you're just
Yes.
everyone's gonna wear pink.
I did.
Yeah.
Color coordinated.
A powerful man. Only powerful man can wear pink. Remember? That's right.
That's right.
That's right. Yes.
Well, thanks for stopping by, and by the way, if you two tomorrow, we're gonna be shooting podcast tomorrow. The time I did a podcast with you it was Munster, and what's amazing, the show's like 5 times bigger than it was a year ago, but from having quality guests like you. But if you want to do it again or whatever, you guys want to pop by it, my son's doing it. But
Hey, man.
Delia, thank you so much
You
for
are so
spending an hour
welcome.
with
Yes,
me today.
thank
I
you
think you're
so much
amazing.
for inviting me.
Okay, all
Real
right.
honor. Thank you so much, Howard. Yes.
People are going to be upset. You guys were just starting to talk about occlusion.
Occlusion, okay.
Oh
okay,
yes.
Okay, okay.
Well, I thought
Yeah.
I'm going to
we were
escape from that.
photobombed. Okay, so
Yes.
before we
Okay,
were so
let's see.
rudely erupted.
Oh yes.
Occlusion.
Yes, occlusion. Tough one. Tough one. I've been talking to so many friends. Before you enroll for a class for occlusion, what's the best way to go? You go to COIS, you go to here, to there. You learn from that the school. Is it enough? How we are going to do those, complicated cases? Are you going to get an ortho class, limited class? You learn more about it. It's pretty tough. What happened to me, I had a very, very good denture class at UCLA, and I was very, very grateful for that because knowing dentures the same way like photography is going to open the doors to full mouth reconstruction cases. It's all about those two front teeth, guys. They drive the treatment plan. You know the buccal corridors, the speech, exactly everything what's going on in the mouth. And it was very, very tough class because, they were checking the occlusion points, the lateral, the protrusive, everything with the light. So let's say if your wax is melting when you set up that denture, you are going to, fail the exam. Was one of the toughest, especially for international, because we didn't have to do so much lab work back home. But we made it. It was a very good educational from the occlusion point as well. Knowing how to do those full mouth reconstruction now, it's like better for me. And then after I graduated, I took Dr. Farran's class on occlusion. He is teaching after all these titans, put together a nice material you can do online, or you can do it also, you can go to his office and he's training you, the right way. I did treat people. I'm not afraid to say. I told you I'm raw, and I did it with no Facebook, with no articulator before because I didn't know, but I didn't have financials, back, how to treat those people. And you will be surprised how much, people can adapt to an occlusion from no teeth with a denture. So many times happened to me. And sometimes you have that little tiny cusp, adjustment there. And it's all about the patient. It's all about, like you said, might be the muscle, might be so many factors involved on that. But I can't give you a right answer which one is the best course. I experienced many situations. I had a very good occlusion course at UCLA. Plus, I felt I wanted to take it to a different level. I took, Dr. Farran class. But it's totally up to the audience to do their homework. And I can't say which one is which, unfortunately.
Would you lean more towards neuromuscular or CR?
CR.
Yeah.
Yes. CR. And as I said, I have friends prosthodontists, and we talk in between each other. We met each other at the kids' parties, all the events, and they all do CR. That's the way they've been trained. If you go for the LVI, they learn a lot about the neuromuscular, right, too. Nobody knows exactly what will be the best way to do it. So I'm so sorry I do not have, a perfect, the right answer for this topic.
Well, I think you are perfect, and all your answers are right. I do. I'm your biggest fan. I mean, I just think
Thank
the
you
world
so
of
much it's an honor for me to be here today, and I'm looking so much forward tomorrow for my presentation. I have great cases, great photography, so I'm looking forward to share with all the townies.
And what's your costume tonight at the costume party?
Well, I can say it. You have to come to see me. You're going to see the pictures later on Facebook, so I'll see you later.
All righty. Thank you so much.
Thank you
You're
so much.
amazing. You're so amazing. Thank you, Ryan.